Welcome to the Pregnancy, Birth and Recovery podcast, the place where you learn how to prepare your body for birth and recover well afterwards. I am Kath Bequee. I'm a pelvic floor physiotherapist, mum of 3, and founder of Fitness Mama. Each week, I share practical, evidence-based tips to help you feel strong in your body, confident and supported, whether or not you're pregnant, preparing for birth, or navigating life and recovery after having a baby. From pelvic floor and core rehab to birth preparation to returning to exercise safely and boosting your postpartum recovery, this podcast is your guide to a healthier, more empowered and stronger pregnancy and postpartum recovery journey. So let's dive in. Hello and welcome back to the Pregnancy, Birth and Recovery podcast. Today we're discussing pelvic girdle pain. It's one of those topics super important to discuss. It's super common. I have treated pelvic girdle pain as a physio who works with women. I have lived it as well. In my second pregnancy, pelvic girdle pain, it completely changed how I function day to day. It completely changed my outlook on pregnancy, and it totally changed my experience of pregnancy second time around. I had been strong and active in my first pregnancy. I thought I knew what to expect. I thought this is a pretty easy gig being pregnancy. Second time round, however, was a totally different story. I had a toddler, less than a 22-month age gap. We were moving house. I was exhausted, and slowly, and then suddenly, my pelvis just stopped coping. And the pain became so bad that I really struggled to even look after my daughter on my own. I couldn't pick her up for nappy changes. I couldn't take her out and about. I was worried she'd run across the road and I wouldn't be able to run after her. At one point, I even needed crutches for a few days. We ended up having to put her into daycare almost full time, and the guilt was huge. I wasn't working. I had to stop working. My daughter was in daycare full time, and I wasn't able to look after her. So it was a slippery slope too. Where there's pain and loss of independence and exhaustion and guilt, it totally can start to affect your mental health. So if you're listening to this and thinking, oh gosh, it is really hard, I want you to know it's not your fault. Pelvic girdle pain doesn't mean that you're weak in your body or mind, and it doesn't mean you're failing at pregnancy. So let's dive in. Well, before we do though, just a quick but important note. What I'm sharing today is general advice that does seem to help a large number of women I see in the clinic with pelvic girdle pain. But everyone is different, and everyone has a different situation. If anything worsens your pain, or if you're unsure what's right for you, and if you're in any discomfort at all, please do check in with your local healthcare provider or a women's health physio for individualized advice. Super important. Okay, let's talk about what could be going on in your body. So what is pelvic girdle pain? And let's also discuss how common it is. So pelvic girdle pain, also known as there's so many different terms for it. You might have heard SIJ, instability, pelvic instability, pubic dysfunction. You might feel pain around the front of the pelvis, the pubic symphysis. You might feel pain around the back of the pelvis, around the sacroiliac joint. Sometimes it's both. Sometimes it can go into the lower back and hip area too. It's really common. Studies do vary. Some studies say 1 in 5 pregnant women experience pelvic girdle pain, but some research suggests it may affect up to 45% of women at some point during pregnancy. It occurs in first pregnancies, second or third pregnancies. It can occur in very fit women. It can occur in women who aren't very strong or fit. And it can occur if you've never had pelvic pain before. So it can affect you for different reasons, and it doesn't affect just one subset, well, that we know of at the moment. It doesn't affect just one group of women. So it's not the fact that your body's breaking down. I do like to think of this pelvic girdle pain. It helps to reframe it, and I know it did for me. Your body is adapting, your body is changing, but sometimes uncomfortably. So let me explain that. There are usually 3 things at play, if we're putting it simply, with pelvic girdle pain. So the 3 main contributors. Number 1, hormonal changes. So there's a whole gamut of pregnancy hormones, and they do help to prepare the pelvis for birth. This means that there is a huge hormonal shift. It's not one particular hormone that's responsible, but a nice cocktail of hormones that helps the pelvis expand, which is so important because that's the baby descends through the birth canal. So we want that pelvis to expand. But it can also mean the joints are a little bit less supported. Now, I really like the fact that the term pelvic instability, that term, it's not used much anymore. So if you hear someone saying, if you're told you've got pelvic instability, that term is out of favor, which I'm really thankful for, because the pelvis is inherently a stable joint, even with these hormonal changes. And to think that you're on an unstable joint by being told you've got pelvic instability, it's not a nice thought. You end up, well, I know when I was told that, you end up walking differently because you're so scared that your pelvis is unstable because you've been told you've got pelvic instability. So it's not a favored term because, one, it's not true. The pelvis is stable even with these hormonal changes. Your pelvis isn't going to fall apart when you walk. Secondly, just the terminology, like the emotions that terminology can bring. It's unnecessary. Okay, so why else does pelvic girdle pain happen? It's not just hormones, it's mechanical changes. So as the belly grows, there's a few things happening. Your abdominals get stretched, they're weaker. Your center of gravity shifts. The pelvis is adapting to create space for birth. So even these small movement changes in how our body's moving can change what's happening at the joint level and can irritate pain-sensitive structures within the joints. We've also got the postural changes. So not only are we moving our body differently because some muscles are weaker than they were, and we've got the different anatomical changes that are happening, the posture's changing and the load changes. So we've all seen pregnant women with a sway back. I know I had the typical pregnancy waddle at some point, and I really struggled to change it, where you're more flexed through the hips, you're perhaps a bit more extended through your back. And I know this is a podcast and I really need to show this visually on a video, which I will get to on my Instagram, I promise. But how you walk, how you stand, how you lift, how you move, especially when you're fatigued, it has a big impact. So unfortunately, all these changes, they can all contribute to pelvic girdle pain. And what I see most often in the clinic, I tend to see 2 broad patterns. And I know I'm getting a little bit technical, but stay with me because I do want to dive into tips and tricks and ways to help support this. But I think this is really important to know. Because 1, if you want to really support your recovery after birth and feel strong again, Fitness to Mama is for you. It's a physio-led platform designed to support your pelvic floor, core, and whole body. And here's the key part. It's actually best to start during pregnancy. Inside Fitness to Mama, you'll find pregnancy-safe workouts,
pelvic girdle pain support, and guidance that sets you up for a smoother postpartum recovery without guesswork. You can try it free for 7 days. No pressure, no obligation. Head to fitnessmama.com to start your free trial.
There's sometimes women I see that have reduced stability in their joints, reduced stability in their muscles, their weakness around certain muscle groups. And there's a whole lot of movement through the pelvis in certain tests and certain movements. But the second pattern of movement I see with second group of women with overactive muscles. So glutes, buttocks that are constantly switched on, gripping and guarding. Same with abdominals. So sometimes it's a combination. We might have weakness underneath, layered with overactivity on top. Add in fatigue, stress, anxiety, caring for other children, work demands. It's no wonder that pain can escalate. So let's discuss what can actually help. Let's think the big picture. And rather than listing rules, I want to discuss, more principles and themes that may help. So, number one. Let's calm things down first. So when pelvic girdle pain flares, often the first thing we want to do is calm down that pain. Calm down any inflammation that's occurring. Help to just settle things down at the moment. This isn't the time straight away where I go straight in for strengthening. So often ice might help. Now, quick side note, ice versus heat. Ice theoretically is what we want because it helps to reduce inflammation. Ice can be really helpful if you are experiencing that pain at the front of the pelvis, that pubic symphysis. However, if you have more discomfort around your glutes and your hips, often we've got really thick muscles. Our gluteal muscles, they're big and strong, right? Ice is unlikely to penetrate more than 1 millimeter or 2. Ice is unlikely to penetrate into that SIJ, that sacroiliac joint. Hence, heat is often used on those bigger muscle groups because heat helps to relax the surrounding muscles. Okay, number 2. Now, this is this is a golden nugget, and this is underrated, I swear. If you take one thing from this podcast episode, it's this. Add in horizontal rest without guilt. So, horizontal rest, lying down on your side, 5 minutes. Not just sitting in a reclined position and putting your feet up, but actually getting off your pelvis and lying on your side for 5 minutes at bursts throughout the day. This is deloading the pelvis, and this can really help to settle irritated joints. And as I mentioned, it's one of the easiest things to do, but it's underrated, and often we don't prioritize this. Bursts, I'm not saying lie down all day every day. I'm saying bursts of 5-minute horizontal rest at a couple of key moments throughout the day can work wonders, seriously. Okay, number 3. Let's talk about exercise and movement. This is where many women, I think, can feel stuck because we all know, theoretically, we don't want to stop exercising, right? Because that's a slippery slope. That means we're going to potentially get weaker in these joints and it will be even harder to move and everything flows on from there. But also, sometimes if we're doing too much of something that's not helpful, it can flare everything up. And I have a lot of women who see me who have to give up exercise altogether because it's just too painful. So rather than giving up exercise, let's think about how we can adapt it, manage it to help you feel better and not in more pain and discomfort. Walking, unfortunately, can often flare up symptoms. And when I'm saying walking, I don't mean just normal walking day to day. I mean a structured walk as an exercise. That's often the first thing we look at. So trying to break these walks into shorter walks, have a rest at the halfway mark, go to the park, have a lie down or have a sit on the bench, do some stretches, but trying to break up some walks. Or sadly, I know walking's free, walking gets us out in the fresh air, walking's a great exercise, but sometimes with pelvic girdle pain, we need to stop it for a couple of weeks to really let that inflammation, that pain settle down, and then we can reintroduce walking again in a structured way. But we don't just want to necessarily stop walking altogether. Jumping in the pool, we might need to introduce really some other movements. So walking in the pool or gentle swimming can feel so nice. That water supports the body weight. It reduces the load through the pelvis. Sadly, exercise classes at the gym, generic classes, they can sometimes worsen symptoms. So do monitor them. Absolutely monitor them. If you can't adapt your exercises that you're doing, and if you're feeling sore after the class or sore that night while you're lying in bed, on a side note, if you've got nighttime pain, have a think, what were you doing during the day to cause that pain? Often that nighttime pain flares up as a result of not what's happening at nighttime, but what's happened during the day. Okay, so Pilates. Oh my gosh, I love clinical Pilates. I support women, small groups in the clinic. Each woman has their own designed program that they do within, and they're supervised by a physio. So clinical Pilates, so many times women who have pelvic girdle pain, I know I'm biased, but it can really help to reduce your pain. If you don't have access either financially to go to clinical Pilates at a physio clinic, or perhaps you live remotely or rurally and you don't have access to that, then a well-designed online program can be really helpful. And I'm saying this with Fitness Mama in mind. We have a whole module inside Fitness Mama with pelvic girdle pain friendly workouts and exercises that support your body during this phase of your life if you've got pelvic girdle pain. Sadly, a lot of the normal Pilates, like group Pilates, mat, reformer, the generic classes, sometimes they can't be specific enough for you and they can't adapt the exercises for you with pelvic girdle pain. So that's why I think clinical Pilates, which is physio run, or try the own online program Fitness Mama with the physio designed home-based Pilates, can be really helpful. So I'm just going to recap because I know I said a lot. Walking, think about your walking. Do you need to chunk it up? So shorter walks or broken up walks where you have a break? Or do you need to start walking in the water, like go to the pool and doing some gentle exercises in the pool? Do you need to either adapt your gym program or Pilates program, and instead do you need to start doing clinical Pilates or a physio designed online program? I think personally, there's the best exercise that you can do is the one that you can do successfully, that feels good, that you can do consistently. So I will say that there is no such thing as a perfect workout. The perfect workout is one that you're actually going to do that helps you feel good. But in reality, that can be really hard with pelvic girdle pain. And it does sometimes limit your options big time. So let me know if there's any questions regarding workouts, exercise options out there. Okay, now I should have said this sooner, because hopefully you're all still listening, but these are exercises that can help to muscles to regulate, so not grip. As I mentioned at the start, so often I see grippy muscles, so grippy glutes, grippy abs, where they're sort of just hanging on for dear life. That's not the technical term I use. This isn't about pushing harder. This is about helping the muscles actually switch off as well as switch on appropriately. And it makes sense, right? If your abs are stretching and they're weaker, your abs can sometimes then grip for dear life. If posturally you're falling into that, how do I explain this? But it's the lumbar lordosis, where your pelvis, that sway back, then it makes sense that your glutes are firing because they're like, hey, I need to help stabilize this pelvis. So these glutes are often switched on all the time. Key stretches I often give in the clinic to the women I assess includes glute stretches, includes some beautiful 4-point kneeling work, cat-cow stretches. I call this a Buddha belly exercise where you're in 4-point kneeling and you're letting your abdominals relax. You're letting your belly drop and flop, and then you're gently re-engaging and lifting up your belly without gripping. If you're unsure what I'm talking about, send me a message on Instagram at kathbequee.physio and I'll help. And I'm also going to do a reel. I mentioned that earlier. Okay, now a bit of a crazy exercise that I think is a game changer. Bear with me, but it's called the butt dance. So this is where you turn the glutes on, turn them off. So you're standing, squeeze your glutes, relax your glutes. Squeeze, relax. Once you've got the hang of that, then try one side at a time. So you gently activate one side, relax. Then the other side, on, off. Left side, you're clenching your glute, just your left side, then relax it. Then clench your right glute, then relax it. Once you've got the hang of that, and you're not gripping, you're not holding, then you might mix it up. You might go left, left, right, 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 left. Hence the term butt dance. Another favorite one, I'm a little bit more specific with this exercise depending on where my patient's needs are, but sometimes squats with a TheraBand around the knees can be great. So a very gentle external rotation with the hips where you're just opening up your knees slightly, and then you're coming with the TheraBand around your knees, and then you're coming into a quarter or half squat. It's a slow controlled movement. You stop before there's any pain or discomfort. It should all be pain-free, and then you come back into standing. So you're doing squats, but with that extra resistance around the knees, which is adding a little bit of extra glutes. It can be a really great one. Okay, a couple of other quick little things I do love. I personally love a girdle belt. It's a pelvic support belt. Girdle is spelled GRDL. Shout out to Fiona, who's a fellow physio I know, who's created this brand. It's amazing. I'll link it in the show notes. I've also done a podcast episode with Fiona. This is totally unsponsored, by the way. Compression shorts can be helpful in certain cases, but I think if you were going to buy one set of compression shorts, I'd leave them for postpartum recovery, which I will talk about in a future episode. I think that's pretty much it. The one I do just want to say, just a word on fear-based advice. You might hear advice like moving like you're wearing a mini skirt, or pretend like you're wearing a mini skirt. Or, some people might say, don't do this or avoid doing this exercise. I do have a love-hate relationship with this fear-based advice. In very inflamed phases, temporary modifications, even crutches can be really helpful. Or temporarily, pretending like you're wearing a mini skirt might be helpful. But this fear-based movement or avoidance of movement can often lead to more guarding, more tension, reduced confidence, and more pain. So I really think movement should feel supported, not scary. So I just had to add that little bit about the fear-based wording that you sometimes hear, especially in social media. If pain is worsening, affecting your daily life, impacting sleep or your mental health, or not improving, as I mentioned at the start, please seek that individualised care. If you're in Melbourne, you're welcome to see me in the clinic at Hatched House in Hawthorn. If you need guided home-based support, Fitness Mama includes a structured pelvic girdle pain program and self-management strategies. So, to wrap it up, pelvic girdle pain can be incredibly tough, physically and emotionally. There is help, and with the right support, many women find their pain becomes far more manageable. You're not weak, you're not broken, you don't have to just push through it. So, if this episode resonated, or if you know someone who's going through pelvic girdle pain, please feel free to share it. That's it. This whole month, the next 3 episodes after this, we're discussing different elements of pregnancy journey. I'm also going to discuss how staying strong in pregnancy is not only helpful for pregnancy, but how it helps with our birth outcomes and our recovery outcomes. I'm also, in the next couple of episodes, you're going to hear some more about if you want to return to running after birth. We're going to discuss the things to do during pregnancy to help increase your chances of returning to running postpartum. So lots of great episodes coming up, and then next month in March, it's all going to be about preparing for labour. So we're going to be talking about reducing risk of pelvic floor trauma with birth, getting strong for birth. We're going to be discussing preparing the body for a C-section versus vaginal birth, tips for birth from a women's health physio. So there's lots of great episodes coming up. Thank you as always for tuning in. If you made it this far, you're amazing. Thank you. Love you. If you want to give me a rating and a review, if you love this podcast, it really does help this podcast get heard by more women who might just need to hear this one episode today. And finally, if you want to join us inside Fitness Mama for that free 7-day trial, come and join us. www.fitnessmama.com. That's it, ladies. Have a fabulous day. See you next week. Thanks for listening to the Pregnancy, Birth and Recovery podcast, brought to you by Fitness Mama, your app for home-based, physio-led pregnancy and postnatal workouts. If you found this episode helpful, please tap follow, leave a quick review, and share it to your stories. Tag at kathbequee.physio. I'd love to connect and cheer you on. And don't forget to check out the free trial at fitnessmama.com/free to start feeling confident, strong, and supported today. Until next time, remember, a strong body, a confident birth, and empowered recovery is something you deserve. This podcast is for informational purposes only and is not a substitute for individual medical advice, diagnosis, or treatment. Please consult your healthcare provider for your personalised guidance.